absolutely thrilled I am to be here with Helene Krasnoff, who is the Vice President for Public Policy, Litigation, and Law at Planned Parenthood Federation of America. And before I do her bio, I just want to say thank you from the bottom of my heart for joining us, for your work, for what you do for women, for humans in this country, for civil rights, for social justice. I think you have one of the most important jobs in America, and you're doing it. I mean, all of us, and we are so incredibly grateful. For anyone who's tuning into a Zioness webinar for the first time, I want to say welcome to Zioness and just tell you very quickly, we are a domestic social justice activist organization for Jews and allies who wish to participate in their activism as proud Jews and proud Zionists. And we launched because a lot of Jews felt unwelcome in progressive spaces. These are the spaces that are our natural political home, places where we can fight and advocate for social and racial and economic and gender justice in this country, and also stand proud of Jewish liberation and emancipation in Israel, which, we can love Israel whether we love its domestic politics or not. I know personally I'm very displeased with American politics, but I'm also a very proud American. And so that's what Zioness is about. And so we really welcome you. Please follow us on Facebook. Please get involved. We have 35 chapters around the country. Reach out to us at about@zioness.org if you want to find your local chapter or you want to start a new chapter if we don't have one in your city. And we will find lots of ways for you to do some really critical work in this moment in particular with coronavirus. There are so many vulnerable communities that need our help. And so Zioness is trying to find action items for people to take even while safe from home so that we can help the marginalized among us. So Helene Krasnoff, as I mentioned, is the Vice President for Public Policy, Litigation, and Law at Planned Parenthood Federation of America. She is responsible for a team of attorneys who challenge attempts to restrict abortion access and reproductive health care. She advises Planned Parenthood affiliates around the country about the legal issues raised by such attempts. She assists with PPFA's efforts to influence state and federal legislation in order to improve access to women's health services. She has been with Planned Parenthood since 2000 and has been involved in dozens of challenges to state laws and policies that limit the availability of reproductive health care services. Prior to joining Planned Parenthood, Helene was an associate with the law firm of Arnold and Porter. She is a graduate of Duke University and the University of Michigan Law School. And it is an absolute pleasure to have you here.
Thank you for having me.
Sorry, go ahead. I was just going to jump right in. I'm just so excited. As I was talking, for everyone who's watching, as I was talking to Helene about these topics, I was getting somewhat hysterical about the state that we're in right now. And she's so calm and so reasoned and has such amazing, information to share with us about her work and how she's working to protect all of us. So I guess, why don't you just start by telling us a little bit about yourself, what you do, how you got here?
Sure, thanks for having me. So like you said, I run a team of lawyers. Our team is 20 at Planned Parenthood, 17 lawyers and 3 paralegals. We're within the national office of Planned Parenthood. And we kind of serve as like a mini law firm for the affiliates, the local affiliates throughout the country. But we don't do their leases or their taxes or the trademark work. The public policy in the title of our department, Public Policy, Litigation, and Law, is an adjective that describes the kind of litigation and law that we do. So we work on laws or policies that directly implicate the Planned Parenthood mission, our affiliates' ability to provide reproductive health care services. Most often that means abortion restrictions, although we also work on a host of other issues related to the delivery of reproductive health care. Our current docket, our staff is the biggest it's ever been. Our current docket is the biggest it has ever been. We have more than 40 open cases right now in the state and federal courts that challenge actions and policies by 24 different states. And we represent 27 different Planned Parenthood affiliates as plaintiffs in those lawsuits.
Unbelievable, the amount, the breadth of the work. So there's an abortion case in the Supreme Court right now. Can you tell us a little bit about that and your work on it?
Sure. So that case, June Medical Services versus Russo, was brought by the Center for Reproductive Rights. It's not a Planned Parenthood case. Planned Parenthood doesn't provide abortions in Louisiana, and that case is about a Louisiana abortion restriction that requires physicians to have local hospital admitting privileges. And if that sounds at all familiar to anybody who follows this issue, That's because the Louisiana law is identical to a Texas law that was one of the two laws the Supreme Court struck down just 4 years ago in a case called Whole Woman's Health versus Hellerstedt. The court looked at that Texas law, and it said that because of the safety of abortion, because there are so few complications, because at most complications, if they rare complications do occur, they happen away from the health center, especially in the case of an abortion using medications alone, that having local hospital admitting privileges wouldn't provide any safety benefit. In fact, it would harm patients' health because it would close half of the abortion providers in Texas. So it balanced the benefits of the law, which it found were basically none, against the burden of the law, which it found would close half of the health centers in the state, and said that was an undue burden. So the text.
Sorry, and just for people who don't know what it means to have admitting privileges at a local hospital and like why that's such a problem, I thought it might be good. And also if you could distinguish between medical abortions and surgical abortions, I think that'd be helpful for, I just am assuming a lot of people don't know the specifics of, terms.
Sure. So admitting privileges are given out by hospitals. You can't just get them. The hospital has to decide that you qualify for them, and they are what a doctor needs to do inpatient care within a hospital. Hospitals don't often, abortion providers cannot get admitting privileges, as courts throughout the country have found, for reasons that have nothing to do with the competency of care, but they don't live near the hospital because often, because of stigma in the community, abortion providers have to travel, or more importantly, because abortion is so safe, most hospitals require a minimum number of admissions. So if you're going to get admitting privileges, they want you to actually use them. This is about the hospital's bottom line. So you have to say you have 10 cases there a year or 20 cases there a year. And that's something an abortion provider will never have because complications are so rare. They will never be able to actually use the hospital. And the Supreme Court looked at all of this 4 years ago. And that's why this is such a weird redux that we're here again with the exact same law. And that's what the trial court said when it looked at the Louisiana law. In Louisiana, it might actually be even more extreme. The providers tried for 18 months to get privileges. They were unable to do so. The law would leave only one doctor at one clinic out of their three right now, 3 independent abortion providers provide abortion in Louisiana. It would leave one doctor at one of those clinics able to provide, and it provides no safety benefit. And the court held a trial, it made those findings. Unfortunately, the Fifth Circuit Court of Appeals said that somehow Louisiana is different from Texas and the doctors just didn't try hard enough. And interestingly, Texas wasn't the first case either. There was a case in Alabama, there was a case in Wisconsin. These laws have been being passed since 2014. And so there are trial records all throughout the country that show the reasons that abortion providers are unable to get hospital privileges, that the Fifth Circuit Court of Appeals just said, we think they didn't try hard enough. So the plaintiffs sought review in the Supreme Court, the Center for Reproductive Rights, because the Fifth Circuit was going to close all but one doctor down. And the court took the case. And there was a bit of a twist in the case too, which I'll get to, but I'll go back to your question about medication abortion versus surgical abortion. We'll go sideways for a little, we'll take a detour.
Yeah, we could come back to it. It just, you would mention medical abortions. We could totally come back.
It helps for context. So medication abortion, there's sort of two general methods of abortion that are available in the United States. One is medication abortion. It's an abortion where the woman takes 2 pills or 2 medications. It's an early method of abortion. It's generally available till 10 or 11 weeks of pregnancy. It involves a regimen of 2 medications called mifepristone and misoprostol. The woman takes the mifepristone first, and then 24 to 48 hours later takes the second medication at a location of her choosing, after which she expels the contents of the pregnancy like a miscarriage. And so when I said that in medication abortion, the pregnancy admitting privileges will be of no use, is because the abortion doesn't happen until the woman has already gone home. And so the local hospital admitting privileges, especially in a state like Louisiana, where there's only 3 abortion providers and many patients are traveling hundreds of miles to get to an abortion provider, in the rare case that the woman would actually have a complication, she would be told to go to her local emergency room and she would get care rather than travel hundreds of miles back, where her abortion provider, who may not even live in that city, because he too or she too has traveled to provide the abortion, would not have privileges. And as for the other kind of abortion, it's often called surgical. We call it in clinic or abortion by procedure because surgery is actually a misnomer. It's different from what you would commonly understand as surgery. There's no incision, there's no general anesthesia, you don't require a sterile field. It's not like what you think of as surgery. Rather, the cervix is dilated by one of a couple methods, and then either a combination of suction or suction instruments are used to remove the contents of the uterus. It is a very quick procedure in duration, anywhere from 3 to 15 minutes, depending on the gestational age of the pregnancy. And abortion has one of the highest safety records of all outpatient procedures with over a 99% safety record. So back to the Louisiana case at the Supreme Court. The court is once again considering really the exact same question, which is do local hospital requirement of local hospital admitting privileges impose an undue burden on patients' access to abortion? But Louisiana popped up and said, wait, if you're going to consider that, we also want you to consider something else. We want you to consider what is called third-party standing. The way that all of our cases and all of the abortion cases for almost 40 years have been brought is that providers like Planned Parenthood go to court and they represent the interests of their patients. So they say it's the patient's right to choose abortion. And so they say this law, but this law that directly regulates me as an abortion provider, because I'm the one who goes to jail if I don't have admitting privileges, not the patient. And it violates my patient's right to choose abortion under the 14th Amendment. And that's what's called third-party standing, because the patient is a third party to the court. The state is one party, Planned Parenthood is one party, and the third party is the patient whose rights are actually violated. So Louisiana said, asked the court to review whether the plaintiffs, the Louisiana abortion providers, should be able to go to court on behalf of their patients at all. And again, for 40 years, the court has allowed this. The cases, Planned Parenthood versus Casey, Planned Parenthood was the provider, Whole Woman's Health versus Hellerstedt, Whole Woman's Health, the abortion provider, was the plaintiff. That's how we sue in all of our cases. But Louisiana says instead that individual patients should have to be required to sue. And they claim, the reason for that is they claim that there's a conflict of interest between abortion providers and their patients, because they're just trying to make abortion safer and we're trying to avoid safety regulation. That's their theory by which abortion providers should not be able to bring these challenges. And again, 40 years of precedent says otherwise. In the June medical case, the court heard oral argument on March 4th, and a ruling could come any day now, well, when the court issues decisions, between now and the end of the term. So the end of the term is usually, unless they extend anything due to the circumstances this year, is the end of June. And so we expect a decision anytime between now and the end of June in that case.
And do you have any insights or, inclinations as to how the court will rule on this?
I mean, of course, there's no way to know what they're going to do, but I think it is worth noting, of course, that all that has changed since the court heard the Texas case 4 years ago is the composition of the court. Whole Woman's Health was decided in a 5-3 ruling after Justice Scalia's death. So only 8 of the 9 members of the court ruled on it. 4 of those justices are still on the court, who are in the majority, but one, Justice Kennedy, is not on the court anymore. He has retired. And so neither of Trump's nominees, neither Justice Gorsuch nor Justice Kavanaugh, took part in the Whole Woman's Health decision. So what's going to happen? It takes 5 votes to win. So you have to assume that 4 of the votes who found Texas's law to be unconstitutional are likely to find this law to be unconstitutional as well, but that still means that you need 1 more vote to win. But there's my doorbell. The webinar's from home.
It happens. Want to get it?
And so we still, it still would take 1 more vote to win. But I think, to be clear, the only thing that would be faithful to precedent on either the issue of third-party standing or on whether or not the law imposes an undue burden is to rule that the providers can bring this case and that the Louisiana law imposes an undue burden. I was encouraged in oral argument that the questions seemed to recognize that the court had already gone over this territory 4 years ago. I was able to attend the oral argument in both Whole Woman's Health and in June Medical, and it was a little bit of, why are we here again, doing this again? And that was encouraging to me, actually. It didn't feel like there was this seismic shift. I think that, again, only really one result can be dictated by that. And so I was encouraged, hopefully. We'll keep our fingers crossed.
Yeah, I mean, so it's, given that there is already such strong precedent on this issue, it would be pretty revolutionary for them to come down differently, right? I mean, it would be a massive shift in policy.
Yeah, I think on third-party standing, it would mean the court really reversed 40 years of precedent saying that the providers, again, the ones who the law actually run against, can't sue to protect their own patients' constitutional rights. In theory, plaintiffs could go to court, I suppose, but let's talk about what that really means, right? We're going to talk about this some more in the context of some of these restrictions, but it's already hard enough for patients today to access care. So on top of that, the court would be saying that basically before a new law took effect, you'd have to find a patient who was right up against that. It's time sensitive. You'd have to find a patient who was right up against it. They would have to say, I need an abortion. I want to go to court. And yes, the state says, well, they can be a doe. Look at Roe versus Wade. They can, use a pseudonym. But using a pseudonym doesn't mean they still don't have to meet with lawyers, file testimony. They might have to be deposed by the state. They might have to sit for a deposition, and all those things, obviously, for someone who's just trying to access care would be very difficult to do. And then, if they're successful and they're able to get an abortion, then the case could go on for 6 more years, and they're the plaintiff of a class, and they could be, do all of those things. And so it would be very difficult to do. And on the merits, it also would be, a reversal of precedent, because there is no way. The Fifth Circuit, in upholding the law, claimed to be following Whole Woman's Health and saying it was different. But I think there's no real reading of Whole Woman's Health that you could say that the Texas law, which in some ways may have even been only closed half the providers, not 2/3, was unconstitutional. But this law that closed 2/3 is not. So I think that any ruling that on either issue that doesn't go the way of the abortion providers really is a reversal of precedent, and the beginning of undermining Roe in the way that when Trump promised to put on justices who would, quote, automatically overturn Roe versus Wade. This case is not about that. Nobody is asking the court to overturn Roe versus Wade, but a right without actual access isn't really that much of a right.
So along the same lines, if on the twist, on the cross petition relating to third-party standing, if the court said that there was no third-party standing, would Planned Parenthood and the ACLU and the Center for Reproductive Rights and groups like that are litigating on these issues sort of pivot to become more like public interest law firms that could provide pro bono legal representation to clients who were, patients actually serving as plaintiffs? Or like how would you envision that Planned Parenthood would react to that?
I think, of course, we would do everything that we could so that our patients could continue to access care, and that might, mean that that's the only way was that they could go to court. Then we would have to help them.
Yeah.
Things. But again, I think that I hope the court realizes what that really means. Like I said, for a low-income patient who's just trying to, basically get care, who would then have to go to court, file a declaration, be deposed by the state's lawyers, stay with the case for a number of years. It could last. This Louisiana law is a 2014 law that we're talking about at the Supreme Court now. It's not like these cases are so quick. And so some patient who's scrambling to get care would, it's a very challenging situation. And to be honest, the reason this is the reason that third-party standing has been allowed in these situations is the laws directly regulate us, and the interests of our patients are aligned in terms of access to care. And so I really hope the court, and at oral argument, only a couple justices seemed interested in this argument. And so I really hope that they maintain precedent and that we're able to work with our patients to sue on their behalf.
I hope so too. So what will the ruling in this case mean for other states?
So I think one thing that's important is this ruling is just about Louisiana. But that being said, like I sort of hinted at also, I think any other ruling except for striking down the law, wouldn't be faithful to precedent and would leave other states vulnerable to similar restrictions. And even if, I think it's also important to note that even if the court follows Whole Woman's Health and strikes down Louisiana law, there are dozens of other cases in the lower federal courts about access to abortion that are working their way through the courts. With the confirmation of Brett Kavanaugh to the Supreme Court, we saw an onslaught of state restrictions, including many of them quite extreme, including these extreme abortion bans in 2019, before many women even know they're pregnant, bans on abortion at 6 weeks. Alabama did an outright ban. So while I think the Supreme Court is, actually unlikely to just pop up and overrule Roe versus Wade any day soon, I think, again, states have layered restriction upon restriction upon restriction on access. And so, I should give an example, of Texas, for example. Before a patient can get an abortion in Texas, they have to make a trip to the health center to meet with the same doctor who's going to provide the abortion at least 24 hours in advance of the abortion, unless she lives more than 100 miles away. She has to get state mandated information at that visit, written and verbal. She has to have a mandatory ultrasound where the images must be displayed to her. The heartbeat must be made audible, and she has to have the image needs to be placed in her vision, and she has to have them described to her. Her only choice is to, quote, avert her eyes and, quote, refuse to listen to the description. She then has to come back 24 hours later. The abortion has to be in a highly regulated facility. If it's after 15 weeks in Texas, it has to be at an ambulatory surgical center. If she chooses a medication abortion, she can't have that another week that is generally provided because they've limited. She can't have it using telemedicine, which is becoming more and more common in the provision of all health services, as we all know, during this pandemic. And none of this is related in any way to science or medicine. It is completely political and unmoored from it. And so before you, and then, this is the majority of patients are low income. These restrictions already hurt low income individuals and communities of color more than anyone else. And so, already your access to abortion today depends so much on your zip code, let alone your economic status. And so, even if we win this case, this is a fight that is going to sort of continue. And, so unfortunately, whatever happens in this case, it's probably likely to at least, well, it's a little bit, again, a tale of the sort of two Americas. For a lot of people, I think it will continue to get worse. And I actually want to highlight one reason I think it's going to get worse. I think it's important for folks to realize. We already talked about that President Trump has put two justices on the Supreme Court, Justice Kavanaugh and Justice Gorsuch. Both of them had records that were hostile to reproductive health in the lower courts. Both of them have not yet ruled until June medical on an abortion case. But there are also two other levels to the federal courts, and they matter a lot. One is the district courts, the trial courts, and those are the ones that usually come in and block the law originally. And so that's really important. But then the courts of appeals is the next level, and there's 12 of those. They're the intermediate courts, and they're divided into geographical regions throughout the country. And those are really important because the Supreme Court actually hears very few cases every term. And so most cases, the courts of appeals are the ultimate say on what happens in these rules. And President Trump, along with Mitch McConnell, have been filling these judgeships at a super alarming pace. I just want to do some sort of facts and the figures for you to draw your conclusions from, but that I think a lot of people, there's so much news and so much information. I mean, and right now, obviously, that was even before a pandemic, that people haven't really focused on this, but more than 190 federal judges have been confirmed in Trump's 3 years in office. At this point in time, more than 1 in every 4 seats on the courts of appeals, 28% in fact, are Trump appointees, more than at this point in any other administration in recent history. And again, that matters, like I said, because those are often the last word, those courts. Since 2017, the Senate has confirmed 7 judges who were deemed not qualified by the American Bar Association. The 190 Trump nominees are overwhelmingly white. 85% of them are white. They're overwhelmingly male. 75% of them are male. And many of them are very young. The average age of the appellate judges appointed since 2017 is less than 50 years old, which means that with lifetime appointments on the bench, which they all have, this is going to persist long beyond any possible Trump administration. And it's not an accident. This has been by design. In fact, during the virus, when McConnell said he wouldn't bring the Senate back to work on another coronavirus package, he said he would hold hearings to get nominees through. So his number one priority was getting more nominees on the bench. And one more bad thing, it's not just who is on the court that matters, it's actually where they are on the court. So I said, these courts of appeals matter a lot. And because they're in geographic regions, the same ones seem to hear more abortion restrictions. So I'm just going to give 3 examples. The Fifth Circuit Court of Appeals, that's the court, includes Louisiana, Mississippi, and Texas. That's the court that at first tried to uphold Texas admitting privileges law and now is trying to uphold Louisiana's admitting privileges law. And I think we're going to talk about this, but also tried to let Texas ban abortion during a pandemic. And that court, there are 17 active judges. 2 of those judges were appointed by President Reagan, 4 by George W. Bush, and 5 by Trump. So that if you add those up, those presidents comprise 11 of the judges of the 17 judges. The Sixth Circuit covers Ohio, Kentucky, Tennessee, and Michigan. And all of those, except for Michigan, pass a lot of abortion restrictions, Ohio, Kentucky, and Tennessee. Those cases then go to the Sixth Circuit. The Sixth Circuit has 16 active judges. 5 judges were appointed by President George W. Bush and 6 by Trump. So 11 of those 16 judges were appointed by just those 2 presidents. And in the Eighth Circuit, that covers Arkansas, Iowa, Minnesota, Missouri, Nebraska, North Dakota, and South Dakota. And that circuit has long had a lot of rulings hostile to reproductive rights, and that's because 5 of the 11 active judges were nominated by George Bush and have been heard a bunch of cases on every time ruled against access to abortion, and 4 judges now have been added to that court by President Trump. And again, it poses a real problem for access because the same states that are enacting abortion restrictions, when we challenge them in the most part, are then go to these judges.
I don't think I didn't know a lot of that stuff before we talked in terms of the actual numbers and how urgent. I mean, I knew it was urgent. We all knew it was urgent, but like those numbers should really wake a lot of people up. I hope that a lot of people are going to watch that and share that. And I know on Zioness, we're going to find some graphics and create some stuff to make sure that people are aware of what's at stake here. So you mentioned some of the COVID-related restrictions on abortion access, and Planned Parenthood has played a huge role, really like the predominant role in making sure that people during the pandemic have had access to reproductive health. Would love for you to give us a summary of what's been going on there. And I know you've been
sure.
So things have, now you're able to join us and we're so happy about it. But yeah, sorry.
Yeah, Amanda tried to get me to do this a few weeks ago and it went in a little bit into the ether, but things have come
just a little occupied. I'd rather she had been spending her time on the things she was doing than be here with us.
So yeah, in reaction to COVID-19, we saw most governors, I actually think it's more than 40 states actually, put in some sort of order that banned non-essential surgeries and procedures. These orders had like 3 purposes. One was to free up hospital space if it was needed. 2 was to preserve PPE, personal protective equipment, which probably nobody heard of 2 months ago, and now everyone knows everything about PPE. And 3 was to reduce the spread of transmission. And abortion providers, like all medical professionals, understood these goals and planned to comply with these orders and provide only essential medical services, and to do so in a way that conserved PPE. But abortion is a time-sensitive service, and it is an essential service. First of all, of course, it is time-sensitive. Pregnancy does not wait. We now see how long this has and will go on. If you are 10 weeks pregnant and you wait another 10 weeks, you will be 20 weeks pregnant, and many states ban abortion at 20 weeks. And while, of course, abortion is extremely safe, it does increase in risk with gestational age. So delaying abortion by 10 weeks means that you're going to have a riskier and also more expensive procedure than you would have had. It also actually will use more PPE the later that you have it because the procedure is a little bit more complex. And then, of course, pregnancy, the choice is not abortion or nothing, that you will stay pregnant. And if you stay pregnant and have a child, you will utilize way more of the medical system, hospital care, as well as way more PPE if you stay pregnant. And then obviously what we then saw was that patients instead were forced to travel out of state to get an abortion, which of course, then they're going to get an abortion if they can manage to make the trip, but that's going to use the same net resources and PPE as had they had it closer to home. But instead they're going to travel and expose themselves and their loved ones to more risk. And it wasn't just abortion providers that were saying this. Leading medical groups like ACOG, the American College of Obstetricians and Gynecologists, the American Medical Association, the American College of Surgeons all said that abortion is time-sensitive essential health care and shouldn't be barred by any order that didn't allow these kind of services. But politicians in 9 different states disagreed and singled out abortion and threatened enforcement of these orders against abortion providers if they went forward. And so we, along with our coalition partners, had to go to court. We worked with Center for Reproductive Rights, the Lawyering Project, and the ACLU in bringing cases in 9 different states, really just asking the court to allow doctors to treat abortion the same as other medical care and continue to provide essential care. The 9 states where we had to go to court are Alabama, Arkansas, Iowa, Louisiana, Ohio, Oklahoma, Tennessee, Texas, and West Virginia. In most of those cases, the courts did protect access to care, and care was able to continue. But speaking of the circuit courts we were just talking about, the Fifth Circuit Court of Appeals and the Eighth Circuit Court of Appeals both ruled on the side of restricting access to abortion. In fact, although we were able to put in a lot of evidence and get 2 different restraining orders out of the Federal District Court in Texas, in a matter of 3 weeks, the Fifth Circuit Court of Appeals ruled against abortion access in 4 different rulings in 3 weeks. We filed 1 application with the U.S. Supreme Court, and we withdrew that application. That was the one time that the Fifth Circuit ruled in our favor, was the day after we went to the Supreme Court, and they backed off. And for 6 days, they allowed medication abortion only. Now, it's important to note, so I'm glad you asked the question, Amanda, because medication abortion is not a surgery or a procedure. It is the taking of 2 prescription medications, which Texas didn't bar any other prescription medications, but they decided
2 pills.
But they said that's a procedure that's banned by our executive order. But it actually only lasted, so we went to the Supreme Court and they said, okay, go ahead, you can do medication abortion. It lasted 6 days, and then they ruled against us and said, no, you can't do medication abortion. But the one thing about this legal whiplash that I think was like lost in all of this, or I think is really the most important, is it was really hard to follow if you're trying to follow it in the news, let alone in this news cycle. But this really has an impact for thousands of patients when there is no abortion available in Texas. And more than that, there were literally patients in waiting rooms across the state every time the Fifth Circuit ruled. It issued 4 different rulings in 3 weeks. So patients were brought in. And remember, we just talked about Texas. You need 24-hour consent of the same doctor. If your doctor can't come back, you have to start that 24 hours again. Or if you have to go to work, you get called in for a shift and you need to see a different doctor, you have to be reconsented as well. And so these were real patients' lives in the middle of a pandemic who were getting hauled in and out of the waiting room to have state mandated information and hope that they could just take 2 prescription medications at the whim of the Fifth Circuit. And those patients are really absent from a lot of the court rulings, as much as we do try and talk about it and make clear what's at stake. And so I think that's just something really important to realize also, that this is like real people's lives in the middle of a pandemic. We had reports of patients that traveled from Texas to Colorado, to New Mexico, to California. I even heard a patient from Texas was seen in Virginia just to access care during the pandemic. And, you know, those are the people who are able to travel thousands of miles. Most of the patients obviously are not. And so, you know, I think it's just really, I think one of the most challenging things is that the courts and the politicians just don't really even recognize our patients as, you know, autonomous individuals who are making choices about their lives. I think that's really one of the hardest things. I mean, the kind of good news in the COVID story is that for now, in all of these states, access has been largely restored as we've moved to sort of opening up. And because these bans on essential services were very hard for other medical providers to not be able to have this sort of income, we saw them relax some of these restrictions. So right now, access has been restored in all 9 of those states. But of course, we don't know what the future of the pandemic holds and whether or not states will have to put back in orders like this or not.
Well, also, and there's the very profound irony of the fact that the people who were trying to shut down abortion access during the pandemic are now working to try to open the governments potentially too early in ways that are going to be very dangerous for vulnerable populations who, it seems, what I heard is that Georgia, which opened last week, is now going to have double the death toll for opening without a good plan, without tracing and tracking and all that stuff. So it's pretty ironic that these are the same people who were trying to shut down abortion access, and now because they're, having to have surgery, that they're going to have to provide this care.
If you looked at the actions of the Attorney General of Texas, they would not be consistent with respect to his concern for the spread of the disease through various civil laws. Abortion was not treated the same.
Way. Such a good way of putting it. So I want to go back just for a minute and put something into context, which is that, when you were talking about the different circuits and the states where this is regularly a problem, where there are more restrictions to access, and those are the same states that were taking action during the pandemic to restrict access. So doesn't that show how pretextual it is that, these are states that have tried over and over again to restrict access, and then there's a pandemic and they're like, oh, great, here's a really good opportunity for us to do what we've been trying to do all this time anyway.
I think absolutely. Those states really are, some with the biggest attempts to restrict access to abortion, and the politicians who pushed it, again, are the same ones. I think that our COVID case in Ohio is our 6th open lawsuit against the state of Ohio, and similar sort of thing in Texas. Yeah, there's some of the biggest repeat players in these access for sure.
We talked about this for anyone who joined us at our Shabbat event a couple of weeks ago with New York Attorney General Tish James and ACLU's Fred Levinson, who is the litigation.
Oh yes, she's in some of our Ohio cases.
Exactly. Yeah. She was filling us in on where things were in Ohio. So we've been having a lot of conversations about this. We had a conversation before the Shabbat event with Lois Frankel, who was talking about women's issues in general and how women are being disproportionately affected during the pandemic. So I think our people are getting really educated. I think actually Zionist people are already following these issues, but it's obviously amazing to have the experts who are doing the hands-on direct litigation work filling us in. So I'm super grateful for that. And also great to have talked to partners, if you're working with Fred on this stuff anyway. So I know this isn't a Planned Parenthood case, but I was hoping you could weigh in a little bit and tell us your thoughts on the Trump versus Pennsylvania case, which for those who aren't following is a case that the Supreme Court heard oral argument on last week or 2 weeks ago, relating to access to contraceptives under the Affordable Care Act. And I know, Helene, that you can't predict the future, but I'm sure that you were following the argument and would love to hear what you think about that.
Yeah, so this one, I'm going to take a little bit of time to explain what's at issue in this one, because this is a tough one to follow. This is actually the 3rd time that this case or something related to it has reached the U.S. Supreme Court. Despite that I say they take very few cases and should be decided once, on both these issues, I'm now saying we're back there. But the Affordable Care Act required that health plans provide coverage for preventive services, no cost coverage, so you can't get a copay for it, and that included women's preventive care. And so it had to be without cost sharing. In 2011, guidance was issued and regulations were put into place by the Obama administration that made clear that women's preventive services include contraceptive counseling and the provision of contraceptives. And so the provision required that insurance plans cover all FDA-approved contraceptives without a copayment. That has been a huge success. It expanded contraceptive coverage without copay for more than 62 million women in this country. But ever since it was put into place, there's been controversy around it. And again, this is like the 3rd time this has gotten there. At first, the Obama administration did 2 things. It said, if you're a church or a house of worship, you don't have to do this. And if you are a nonprofit religious employer, then you can have an accommodation. And the accommodation said you just basically have to raise your hand and fill out a form and say, I don't want to provide this coverage. And the government would take over and work with your health plan to provide the coverage. And that was important because it had to be seamless coverage, so the patient actually had the benefit in their health plan rather than having to go somewhere else to get this coverage. Some for-profit entities who were left out of those exceptions sued, most notably Hobby Lobby, which is what you probably heard the name of the case. So that was the Hobby Lobby case, and Hobby Lobby won at the Supreme Court. And so what Obama did in response was it expanded the accommodation and said, okay, for-profit religious employers, you can raise your hand too, and we'll take care of the coverage. But then those employers, and in particular the religious employers, then complained that they didn't like the accommodation, that it was too much of a burden on their religious practice to have to raise their hand and to have their health plans cover insurance. So they got all the way to the Supreme Court in a case called Zubik versus Burwell. But that case actually remained unresolved partially because Justice Scalia had died between the time the court took the case and the time the court heard the case. And so I believe the court probably was split 4-4. So the court ended up sending it back down, saying to the government and to the Obama administration and to the religious employers, like, can't you work this out? Like, what kind of accommodation can you agree on? And then when that got remanded, the Trump administration came in to office, and then they issued 2 sets of rules that essentially eliminate the accommodation. They make it optional and say, you can take the accommodation if you want, but you can just get out of it altogether and your plan doesn't have to cover it. And they went beyond the nonprofit employers and the for-profit religious employers and said, basically anybody with a religious or moral objection doesn't have to cover this. A number of states sued, and the case that made it to the U.S. Supreme Court, the state of Pennsylvania and New Jersey are the plaintiffs. The lower court said that the Trump rules went too far, that when the ACA was enacted, it meant to include this benefit. And so just letting anyone out of it went too far. So it's those Trump rules that are issue. And what will the court say, which I think was your question. So again, there were 5, but it's just it's just like such a complicated thing. There were already 5 votes in Hobby Lobby, with Justice Kennedy on the court. So no one obviously knows how Justices Gorsuch and Kavanaugh will vote, but I think that is likely. They're probably very sympathetic to religious objection. On the flip side, I will say that the Trump rules are very extreme. They go beyond religious exemption to include moral exemption. And also, I think in this area, in particular, at oral argument, we heard a lot of discussion of compromise, which is, where the court was in Zubik as well. And so I think the court, it's possible, will try and reach some kind of compromise or send it back again for some kind of compromise if they think this went too far. And that case is also this term, meaning we should have a decision by the end of June.
So it's really scary. I mean, 62 million American women were having access to contraceptives under this particular provision. So what will happen if?
Well, not all 62 million employers object, right? So, I think it is certainly impactful. And to be clear, the way insurance works, of course, it's their spouses and daughters and things as well who are covered. So even if you work for a religious employer, even if you work for a nonprofit religious employer, if you choose to work there because your values are aligned with theirs and they choose not to have coverage, that impacts again your spouse, it impacts your children. And so the impact, most employers are not objecting to this coverage, which both their employees want. I think that's something like 9 out of 10 women will use contraceptive at some point in their lives or something. And also it's a cost-saving measure because, yet again, we talked about this, the other option is pregnancy, and birth is actually very expensive on the healthcare system. So it is a routine. This is why it was put in there under the Women's Preventive Health Benefit, is it is a common and routine preventive health care for women. And so most employers will not object. But yes, the precedent that your boss gets to decide, again, this is not about providing contraception. This is not saying to a doctor, you have to provide contraception against your wishes. This is about insurance coverage. You as an employer don't have to provide insurance coverage for your employees, who then get to make the choice, their own choice about whether or not to use that coverage or not. And so, it is alarming that is where the fight is. But it has been now for, this is, again, when those Obama rules were 2011, so almost a decade, they have been fighting about having to fill in a form that will allow people to have the choice of whether or not to use their insurance coverage for contraception.
Unbelievable. It just, Okay. So actually, I have a bunch more questions, but somebody put a question in the Q&A that really it relates to how I feel, so I'm going to ask it. It's Barbara Palmer's question.
Okay.
Said, how do you stay positive and not feel defeated as these cases pile on and you relitigate these issues? 20 years and more cases and more states fighting, and the list. I think, Helene, correct me if I'm wrong. The list is longer than ever. You said you have more staff than ever. The assault that has been decades in the making is coming to fruition now on women's rights. So I feel like the work is harder than ever. So I think it's actually a really important question. I mean, you're so inspiring. You have a smile on your face and you're, so instructive. How do you do it?
I'll get weepy because I do actually get kind of emotional about it probably when they respond to this question. But, I get a lot, I really do get a lot of strength from our affiliates, and in particular, our doctors on the ground. People go to, and not only our doctors, all of our healthcare workers and clinicians, people are out there every day actually providing compassionate care to patients who no one else wants to serve and who really need this care. And so I feel like I get to sit in an office in DC and push paper around to try and help them. So I think it's a total privilege and honor, and I feel honored to do it. And those relationships to me are incredibly meaningful. And so, the right is totally meaningless, like I said, without both the access and there's someone willing to provide the care. And so I do get kind of weepy because I just feel very privileged to be able to help those patients any way I can with my law degree, as opposed to actually, I am amazed by our staff who are there day in and day out in a pandemic, trying to support people's ability to control their own lives. And so I feel incredibly grateful.
I'm sorry to make you.
I will get, like I said, I do get weepy because, that's to say, of course, I wouldn't have done this for 20 years if I don't care, right? So that's what I try and center. I try and center our patients and more importantly, our providers who do this. And that's how I think of it.
Well, Barbara said we are so privileged to have her voice for us. I could not agree more. And I'm sure we're both sorry that we made you so emotional. But first of all, stop telling yourself, and I know Barbara, and I know what she would say to this, which is stop telling yourself that you're just pushing paper. You are a literal hero. I mean, you are my hero. I'm so serious. I am so serious. I am a lawyer, and I have not done it. I'm not practicing right now. And to see what you've been able to do with your law degree to protect millions of women around this country is what it means to us is very hard to express.
Yeah, I have a great staff, and also we do work really closely with our coalition partners. Actually, you said Tish James was here. I will say that the AGs have been this unbelievable force lately. I mean, we've seen this. We saw this literally the second the travel ban was put into effect. And so it's just a lot. I mean, there's obviously you guys are interested in this. There's a lot of momentum and force on on the side of protecting access to care and to have and I think in the pandemic in particular, it's never been more obvious that people need more access to healthcare, not less access to healthcare right now. And so, there's a lot to be not being down and to be inspired by, right? I mean, I think that those AGs have been heroes in this time period in terms of fighting for people's civil rights all over the board. And there's lots of people, and like I said, and our providers are heroes. And I don't feel that way about myself, although I appreciate you all saying it. But I think that there's just a lot to feel positive about. No, but there is a lot. I mean, the question was how I feel positive, right? So
I get it, and I know this is not the purpose of this webinar, but Barbara, who tells me all the time that I am allowed to, be proud of my accomplishments, would tell me to tell you that your accomplishments are trailblazing and more important than anything in the whole world.
Well, thank you.
Please.
But we have great, we have great staff. We have great coalition partners. But that's the thing. Is it's not, you're not doing it alone. None of us are doing it alone.
Right. Yes, and having wonderful people around you is the most important thing. And partners and
great.
The most important thing that we can have right now. So there's two things I wanted to say. One is you led me directly into my next question, but also going to the AGs and also what's happening on the state level in this context is really fascinating. I mean, last year, and Tish played a role in this, but Cuomo signed an executive order that was protecting, basically extending Roe beyond Roe, saying that New York protects reproductive access as abortions are a fundamental right. And no matter what happens with Roe, no matter what happens in the judiciary, New York will protect women's rights to access reproductive health care. And I know that there are a bunch of other states. Virginia actually just signed a similar executive order a couple of weeks ago. So there are options. There are ways for, governors, and this is not exclusively a partisan thing. I think that in Rhode Island, I think there was a Republican governor that signed something similar. I'm not positive that was the state. But there are ways that if we push hard enough, if we fight for this, then we can make it, we can still protect reproductive health and justice and rights and access, even if there is a rollback of Roe, which I think we can't anticipate seeing. But that's a question I hope we'll get to. I wanted to ask you, because you were saying we need more access to care during a pandemic, not less. And I couldn't agree more. And I was wondering if you or Planned Parenthood or any of your partners were seeing actually a spike in need in terms of reproductive access, abortion access in the pandemic, while there are a lot of people quarantined at home with abusers, often, whether this has been a situation where access to care is being shut down while the need is increasing, like where it's statistically proven data on that.
Yeah, I don't think there's obviously been any studies done here now yet in this pandemic. I think that the conventional wisdom is that obviously the need for reproductive health care doesn't stop with a pandemic. And I think that there probably is a spike in need, but it's obviously harder to access those services in the pandemic. And in particular, you talked about in the situation where there's domestic abuse, when you're sheltering and under the watch 24/7 of an abuser, if you just think about the restrictions we talked about, letting alone the pandemic, of having to go to the clinic twice, of having to meet with the same doctor who's there on that day. I mean, it is truly virtually, it seems impossible. And so I do believe there are probably, a lot of patients who are going without access to care, again, who are not able to drive to Colorado and back when Texas was banning abortion. And so if you just think about those restrictions and how somebody who is sheltering with an abuser could navigate them, it's just truly, it is impossible and a very sad situation to think about.
Devastating. It feels, I am surprised there aren't studies. Sorry, there's something outside my window. I'm surprised there aren't studies. I wonder if there will be, but it feels impossible that there isn't a desperate need right now that's not being met.
Yeah, I would think so.
Okay, so to get a little emotional again, it's very emotionally difficult to think about this, but if, as you mentioned, Roe technically stands, but we see death by 1,000 cuts, we see ways to roll back reproductive access without actually overturning Roe, which for people who are not lawyers, to overturn Roe would be a massive, the Supreme Court can't just take an old case that has stood as precedent for decades and say we don't like that anymore, but they can do what they've been doing, what Helene was describing. So, I mean, I don't even want to use these words, but I was thinking of coat hanger abortions. I mean, what will happen? We will go so far back in time. What options will women have? You mentioned travel. Some women may have that privilege of traveling. Women are going to have to make dangerous decisions, and how will this particularly affect low-income communities and women of color specifically?
Yeah, so I think one thing that I think would be good to take away is that this is already reality for lots of people, right? I think there's now 6 states where there's only one abortion provider in the state. South Dakota, Missouri, Mississippi, West Virginia. I can't get the other ones off the top of my head, but I think there are 6 or 7, right? And so if you're a low-income person in those states, they all, almost all of them have the 2 trips and the waiting periods. And so we already know that people today are already desperate. I mean, I think one thing that is different from the coat hanger is that people try and get medications through some means that are not legal probably to purchase them, but there is evidence that there are safe ways for someone to terminate a pregnancy using medications. It's probably somewhat different from when you say the word coat hangers, but look, there already again there are providers and justice funds and who are trying to help people access care as much as they can, and they'll continue to do that. I mean, abortion is safe, it is legal still, all 50 states. And so, I think, the focus has to be on, getting people the access that they need.
Okay. So besides voting, and I do want to talk a little bit about voting. Zionists, as I think everybody knows this, I know Helene knows this, we're 501c3. We cannot and do not endorse candidates for public office, but obviously people who are tuned in believe very strongly in this issue and are thinking about their values and how they want to vote. But the numbers, Helene, that you mentioned at the beginning, I think should really light a fire under everyone. And remember that this is not just about the White House. We need to be thinking about voter turnout and making sure that people have absentee ballots and mail-in ballots, that we're thinking up and down, state level, federal level, that we're doing everything we can to protect women and all the other vulnerable communities that are affected right now. And so, but I wanted to say, besides that, besides voting and obviously besides supporting life-saving organizations like Planned Parenthood, which I hope everyone will do if you're not doing it already, which I'd be surprised, but I hope you will. Can people listening take action? Is there anything we can do? It's been really hard from home. The name of the series that we are doing right now, we called it the Social Differencing Series, and the goal was to give people a way. We're socially isolated from each other, but we want to make a difference. We want to do something. So do you have any action items, any suggestions for things that we can do? Educating our circles on these issues, taking this webinar, sharing it, telling people the numbers that you were giving, anything else?
Yeah, I think, hosting events and talking about it and all this sort of stuff is, there's lots of opportunities for this sort of stuff. There is legislation out there on the state and federal level, obviously trying to get senators to care more about who they're putting on the federal bench, all that sort of stuff. And I too work for the C3 organization, but if you go to I Stand with Planned Parenthood, then there are the take action button. And I think that there's other ways to get involved in that with our C4 organization also.
Okay. So I hope everyone will do that. Freda said the same thing, that ACLU has action items too. So I hope people are signed up for those and doing that, because we need to get the word out. Not everyone is following this issue as closely as some of us are. Okay, so the last question, and then we'll wrap up. I can't tell you how much of a pleasure it was for me to find out that the badass woman who is leading Planned Parenthood's national litigation efforts is a Zionist. And when we first talked to you, told me that you were supposed to be in Israel next month with your family, and it was going to be a pretty big trip for you guys. So bummed for you that it won't happen this summer. But as I said at the beginning, thousands of people have joined this movement across the country in all of our chapters and all of our grassroots and our grass tops activists. And they're really inspired by leaders who are doing this critical work and are moved by their Jewish identities. So I was just hoping you could reflect a little bit on that, on how your Jewish identity drives your commitment to this work.
Sure. I told you this a little when we talked. I was raised in a conservative synagogue and a kosher home, and probably Judaism was probably the one sort of defining feature of my home growing up. My mother's value system. I'm not religious today either. I do, though, continue to associate with Judaism. I belong to a synagogue, and I think in their words, my kids would say I'm forcing them to have the name mitzvot. My daughter's already had hers. And I guess the reason I stay with Judaism partially is the sort of core ethical and civil rights kind of tenets that relate to Tikkun Olam, the mitzvot. But I always say what I used to say, and you worked at a law firm too, I think, right? Is if you're going to spend all those hours sort of doing work and not, I used to joke and say not watching bad TV or whatever, which maybe in the pandemic is you're doing both, but it's why would I not? Why would I not do work that I cared about for all those hours? If I could both work and do something that I cared about, I'd rather otherwise be watching TV. And so you can do work that is not helping anyone. You can do work I used to call morally neutral, which, I think a lot of jobs are, and I don't judge anybody who does any of those things. Everybody needs to make a living, but I just felt for me, if I was going to work all those hours, I wanted to devote it to something that I cared about. And I think, when you ask, to me, I connect a little bit to some of those core Jewish values and just thinking that way on a very high level, which is we have a place here to do something to help people. So that's kind of how I connect to it at this point, not being very religious, but also connecting.
Yeah. being a Zionist. I'm not religious either, but feel so connected to my Jewish community and to Israel. I feel like my Zionism is really a core component of my Jewish identity. So it's been amazing to talk to you. It's amazing to learn from you.
Thank you for having me.
This is the first time we've made a guest cry. But
if you knew me, it's like TV commercials make me cry. It's not no, but I know. I mean, but I think it's important. I do think it's important to think about, right? Like, if you think about it at the political and the legal level, it's totally meaningless without like actually what happens on the ground. And when you think about who our patients are and the communities they're in, like, I think it helps you center why lots of people care about this work. And so I'm kind of happy to do it on that regard. I can't help it because I care, but like, I think it, I do think, and the question specifically was about, the positive. And so I like to think about it.
Yeah, the emotional investment, being professionally committed to something that you're so emotionally invested to, I think is very empowering and very meaningful, but also can take a toll. And I think, but that's what drives you, and that's incredible. So thank you so much. I'm looking forward to staying in touch, and just super grateful for your time and your enthusiasm and your work.
Thanks for having me.
Actually, I should say really quickly for people who are still here, next Tuesday at 6 p.m. Eastern, we're doing another webinar with Dr. Ruth K. Westheimer, and she will be interviewed by her granddaughter, Leora Einleger, who is our wonderful Zionist manager. And it's going to be amazing. And if anyone hasn't already watched the Dr. Ruth documentary on Hulu, I highly recommend it. It's incredible. And we will be talking a lot about the same topics that are covered in the documentary, but of course she'll be interviewed by Leora, so we'll go a little bit more in depth. So really looking forward to that. Please register at zionist.org/events. And that's it for now. Thank you again, Helene. You're incredible.
Thanks. Sure. Thanks for having me.